I don't think we need any more data to convince ourselves or anyone else the value and the role that exercise and fitness plays in so many health conditions. We need to work collaboratively and effectively together to realize the assets that the fitness sector has to offer.
This is All Things Fitness and Wellness, uniting industry thought leaders and fitfluencers on the mission to inspire innovation and encourage people to live a life fit and well. On today's episode, we're zooming out to look at the fitness industry through a North American lens. I'm joined by Zach Weston, Executive Director of the Fitness Industry Council of Canada, the organization representing roughly 7,000 facilities and 7 million members across the country. Even if you operate in the US or anywhere globally, this conversation matters. Canada is tackling the same industry pressures we're all facing: policy momentum around preventative health, affordability, consolidation, and the push to reach the inactive population at scale. And the strategies taking shape in Canada often mirror, influence, or complement what's happening across the US and international markets. Zach brings a rare mix of experience across kinesiology, business, health systems, and entrepreneurship, which gives him a broad, practical view of where the sector is heading. Today, we're digging into the big questions. What's really shifting as we head into 2026? Where is movement accessibility actually gaining traction? And how can operators on both sides of the border and globally strengthen fitness as essential infrastructure? Before we get to it, be sure to hit like and subscribe. We have new podcasts weekly featuring industry thought leaders and influencers. I'm your host, Krissy Vann, and this is ATFW. Let's dive in here. So Zach Weston from the Fitness Industry Council of Canada. Zach, maybe just give a little bit of an introduction because you did take over the reins this year from Gabriel Hardy. So tell me a little bit about why you decided to step up into this role with the Fitness Industry Council of Canada.
Well, I think I can sum it up in really one word: impact. And, I've been in the health and fitness sector my entire career. I've been a fitness owner operator. I've been a fitness provider. I've been a healthcare provider and a healthcare administrator. And I think it's that combination opportunity with the Fitness Industry Council of Canada where I can really roll all of that into one. And, we represent over 7,000 fitness facilities across the country and millions of Canadians. And it's that ability that we have to impact not only their health, but their fitness, athletic performance. And that's what really excites me.
For our US listeners, and obviously a lot of operators will put two and two together here, but basically the equivalent of what we have stateside, I say we, I'm not American, but regardless, the Health and Fitness Association, a lot of the advocacy work that is taking place on that side of the border parallels a lot of what we're trying to achieve here, and that is making fitness more accessible to more individuals. So the one thing that I'd say, Zach, that's been interesting for me as somebody that's been interviewing a ton of people in the space is that the sentiment stateside is that there's been a lot of really positive momentum for the fitness industry this year. We have been seeing a lot of great reporting and numbers, the growth in the HVLP space. But I'm curious, how would you describe the current state of the Canadian fitness sector as we step into 2026, especially since you do have a lot of familiarity with themes or pressures that your members are experiencing?
Yeah, it's a great question. And I think it really cuts to the heart of our mission at the Fitness Industry Council of Canada. So, as we step into 2026, the Canadian fitness sector is defined by a powerful and transformative dual reality. We've got robust recovery from COVID and growth intertwined with an urgent push for recognition as an essential health solution. So I would say from longevity, prioritized programming to high rocks, we're seeing a strong rebound in the fitness sector across Canada, with key themes continuing to drive engagement in the performance and personal health areas. So in addition, the growing and important role for fitness facilities to provide a community and recognition for its role, its vital, critical, and essential role in supporting mental health. So our market in Canada, we represent over 7,000 facilities and 7 million members. And, we've demonstrated resilience and we're on a positive trajectory. Both the sector's long-term success hinges on addressing key themes and external pressures. So we really think that the fitness sector is no longer just a nice to have discretionary spend. It honestly is rapidly positioning itself as a critical extension of the Canadian healthcare system.
Yeah, and that integration isn't just here. I mean, really, from an industry side, that convergence of health club and healthcare is rapidly growing in momentum. And you and I are well aware of how that would be ultra beneficial when it comes to battling chronic disease and ultimately saving a quite taxed Canadian healthcare system. And I'll take the onus of saying that. And so it makes a lot of sense if we are taking the onus and the accountability ourselves to be more healthy individuals. That's going to help that system. So on that topic, we talk about the Personal Health Investment Today Act a lot stateside with the HFA. Here in Canada, we have a pesky tax line that doesn't seem to want to go from ineligible to eligible. So reflecting on 2025, tell me a little bit about some of the advocacy wins or movements first that stood out, and then we'll talk about some of the work that still needs to be done.
Well, I would say, the single most impactful event of 2025 in Canada in the fitness sector was certainly the successful election of my predecessor, Gabriel Hardy, who is now a member of Parliament representing the community of Montmorency-Charlevoix, the region in Quebec. And so we now have a tremendously strong ally in government who has historically been a champion for the fitness sector. And he's continuing to work now from the inside to challenge government and to the healthcare system that you just talked about, Krissy. I've worked in that healthcare system as a provider and also as an administrator. And I think we can all agree it generally does a good job at managing disease, although oftentimes the wait time for access to care is the challenge. But what we don't do well is invest and provide services that are linked towards prevention. And I think that's an area that the fitness sector is poised to play perfectly. The data, I don't think we need any more data to convince ourselves or anyone else the value and the role that exercise and fitness plays in so many health conditions. We need to work collaboratively and effectively together to realize the assets that the fitness sector has to offer. So with regards to advocacy wins, most certainly, now having a representative in government who is so clearly passionate about what the fitness sector can do, that's without question been our biggest win.
To have somebody that understands intrinsically and brings that passion and the network, it's going to be really interesting to see what happens as his time there continues. Now, I know one of the big things with the FIC is a strong focus on increasing access to movement. Obviously, some of those elements that we spoke to from a policy side of things would help with that. But what do you see as the biggest opportunity to reach some of our inactive populations in this country? Because I actually just got off an interview with a behavioral scientist where we were talking about that January surge. And even then, you're only getting a tiny portion of the population that is having those goals for movement. And unfortunately, we don't always retain those members.
Yeah, it's a great question, Krissy. Independent data that we've obtained through our partnership with the Health and Fitness Association, or the HFA, that they drove through their relationship with independent researchers from Portis. Their data highlighted that time was not the number one barrier to fitness. And to be honest, that surprised me because I've been hearing this for decades, that time is the number one reason people aren't as active as they should be. But rather, cost is the number one deterrent among those who aren't active and don't have memberships to fitness facilities across Canada. And that reality that it's cost, it's not independently unique to Canada. That seems to be consistent also in the United States and in many other countries across Europe where Portis conducted this research. So we know that the fitness sector in Canada has ample assets and facilities that could be utilized more effectively in public-private partnerships to bring current non-users into these facilities for the purposes of improving and augmenting their health. I had an opportunity, and I reflect on when I did work in the publicly funded system when I worked for the Ministry of Health in Ontario, and I had some funding that I put towards developing and driving a win-win partnership between a public and private institution. And the purpose of that program was to provide funding and a service for chronic disease prevention and management, and specifically for diabetes prevention and management. And what we were able to do with the same amount of funding, we were able to greatly reduce wait times, and we were able to serve 10 times as many patients in that public-private partnership model compared to only doing it in the publicly funded model alone.
Mm.
So I think this is a great opportunity for the fitness sector to, really step up and be a partner with the healthcare system to introduce fitness and exercise to those who've never gone to a gym or have never had a membership to a fitness facility.
Yeah, I wholeheartedly agree. And then the other side, of course, is on that advocacy and policy change. And, you talk about the data, you talk about the research, and that is one thing that's been great with some of those partnerships through HFA, that they're now providing more research documents. So when people are going to Parliament or are going to Capitol Hill, they're able to back up the investment, because ultimately dollars matter, and that's what's going to help move the bottom line. Help people understand, because I know that members of the FIC are familiar with kind of the big tax line that you're advocating for, but there could be individuals that maybe aren't involved that aren't familiar. So tell me a little bit about kind of the big fight that the FIC has been doing over the last very long while.
Well, this is a conversation I had with Liz Clark on her podcast not too long ago, and I think I referred to this line on the federal tax return, that the CRA recognizes certain medical expenses and they don't recognize fitness on that line. I called it the Patrick Waugh and Wayne Gretzky line. It's line line 33099, so 33099, and there's a lot of important things that the CRA does recognize on that line, but the expenses that we as Canadians pay for gym memberships, for buying a treadmill, for buying running shoes, they're not recognized there. And we now know that cost is the number one barrier. But interestingly, the data shows when we look at the price elasticity, a 10% reduction in that cost or through a tax incentivization would drive a significant growth in the number of Canadians that do engage in fitness facilities. And I think it's timely that we need to start thinking about different ways of engaging and getting Canadians active. We just had the latest participation report card on physical activity levels of Canadians published a couple of weeks ago, and nothing's changing. We're
Mm.
we're stagnant, and
Yeah. Can you elaborate? Like, do you remember any of those offhand, or give people a picture of the Canadian grade?
yeah, well, the grades continue to hover just below 50% of Canadians achieving the physical activity targets. And we've poured a significant amount of money into awareness campaigns and advocacy work. It's not working. It's time to think about investing in other ways. And frankly, Krissy, having been a clinician working with patients in chronic disease, I ran cardiac rehab programs for over 2 decades. I don't think I've ever come across a Canadian who did not already know that fitness and exercise was good for them. Yet we continue to put money into awareness and advocacy campaigns to remind Canadians or educate them on things that frankly they already know. But when I look at our tax policy, I see that there's some inconsistencies when we're trying to incentivize certain types of behaviors. For example, we don't apply GST, PST, or HST on the purchase of healthy, fresh fruits and vegetables because we want Canadians to eat healthy. But we also want them to move and we want them to be physically active. And, a component of the Canadian physical activity guidelines includes resistance strength training a couple of days a week. And I'm curious what the government's thoughts are with regards to where do they expect Canadians to do that safely, effectively, what exercises should they do, what sequence, what weight to lift, what progression rate should they be following. This is a lot more complex than simply telling people to go out and walk in their neighborhood, which is, of course, a good thing to do. But resistant strength training, it does have a bit more complexity to it, and increasingly we're seeing more and more research showing incremental value and perhaps arguably even more benefit than going for a walk. So, really looking at tax reform in this case, and recognizing fitness related expenses on line 33099, or the removal of GST, PST, and HST would be very, very helpful in our advocacy to get Canadians to actually, take some action.
Well, and in regards to taking action, we want Canadians to be able to take action in their own health. It's funny when you said, I think every Canadian knows that fitness is good for them. And I just think of my old news reporter hat, how funny it would be if I set myself up to do streeters and say, hey, did you know that exercise is good for you? What are your thoughts? And they'd just go, yeah, I'm aware.
Yeah, it's like,
So to your point, it's not the barrier.
yeah,
That's for sure. But yet that seems to be the problem we keep trying to solve from a top down perspective. So when it comes to taking action, I know that there have been a lot of discussions with our friends stateside about really unifying the industry. And we've seen a lot of that happen, especially in, I hate bringing up the pandemic, but in the post pandemic era, I think it just brought everybody onto a same page, same team. So, from the perspective here in Canada, like for example, in the States, there's Capitol Hill fly ins where everyone's coming down together. What's kind of the equivalent that we have in regards to how operators can also help move this message forward?
well, I think one of the important things that we need to do in Canada is continue to unite the voice. And that's really, one of the reasons why the Fitness Industry Council of Canada exists, is to unite and bring that voice of all of the owner operators of fitness facilities across Canada in a not-for-profit organization, so that when government or insurance or other businesses speaking with the Fitness Industry Council, they're speaking with a not-for-profit organization who has really got the best interests of Canada at its heart. Certainly we advocate for better operating conditions for the fitness facility owner operators, but we also got into this industry because we're passionate about the impact and the value and benefit that fitness can provide. So, I would say that is one of the critical things that we really need to see, is continued strength and membership in the FIC, and not just passive membership, but active engagement and membership with the FIC to participate in our forums, participate in our surveys and the data collection, so that when we are having these conversations, we're doing so with current and up-to-date information.
I'm just curious, when you have these forums, what have been kind of the primary topics that have come up time and time again from your membership this year?
Two main themes, cost is one that we've talked about, and driven by tax and that capability to be able to offer access and opportunity for people to be able to get into fitness facilities more financially cost effective. These facilities, increasingly with inflation and the international tariffs, as they're looking to upgrade their facility equipment and so forth, it's expensive. And we have to appreciate these are businesses that do need to be fiscally responsible. Secondly, of course, we are also looking at the utilization of music in facilities across the country. And I've got a lot of musicians in my family, and we recognize the importance of supporting the artists and ensuring that they are compensated for the value of the music that they provide. But the challenge that we're also facing is significantly hefty increases in the tariffs that are applied to the music that is played in fitness facilities. And so we're speaking as the voice with the Copyright Board of Canada with regards to ensuring that any increases in fees related to music are appropriate. I think we also can realize that a lot of consumption of music has changed in the last 20 some years since these tariffs were first introduced. Increasingly, we're seeing people that are going to the gym, they're streaming their own music through Apple Music or Spotify, and they're not listening to the overhead music like they did, 15 or 20 years ago. So we are working hard on behalf of all of the members of the Fitness Industry Council of Canada to prevent significant hikes in those fees.
They do need to move with the times, because even further than that, what people are streaming on their Spotify or their Apple and their headphones, some of it aren't even artists these days. Like was a top 100 Billboard chart was an AI piece of music.
Yes.
So if there was ever a signal that maybe your laws from 20 years ago might need to change, probably that, but we'll see. I know early adoption of things isn't always necessarily synonymous with government, but that's okay. This is why we have advocacy.
And hopefully some people are streaming and listening to your podcast too when they're at the gym.
Exactly. There you go. Nothing like invigorating the workout here as we switch topics to consolidation and mergers and acquisitions. So buckle up and press a little level 11 on that stair climber. I started the conversation saying that, there has been this tremendous momentum stateside. So I'm just curious about what the consolidation and M&A activity looks like on this side of the border.
Yeah, so what I'm hearing in this space, Krissy, is that big chains are continuing to expand fairly aggressively. So those big chains, and they're acquiring retail space from some of the old Canadian Tires that have closed, Zellers, the Bay, etc. So we've got some vacancies, and so they're expanding. So organizations and national brands like Crunch and Planet Fitness, those high value, low price facilities, they're really driving a lot of that growth. We're also seeing some private equity backed expansion, both in Crunch, in that franchised approach. Movati has continued to open across Western Canada, and now we're seeing Altea, which is a fairly new brand, expanding and testing some of the new programming and experiences. The Good Life, which I believe is globally, I think they're the largest independently owned fitness chain in the world. They've also done some acquisitions and upgrades to existing locations. They've converted some of their Good Life clubs into their Fit for Less brand, with demand for some of the smaller, more boutique locations. And many big franchise brands are scaling in Canada now. So we're seeing F45, Orange Theory Fitness, Strong Pilates, Club Pilates, and several more experienced brands that are growing in this space. So 5 years after the pandemic, we're now seeing several club improvements, new programming and spaces being added and renovated, and recovery space, niche group fitness, strength spaces, expanding like High Rocks, and also workplace fitness, which is expanding to create more community and wellness across the country.
So good news on this side of the border in a nutshell. I mean, there's just been a lot of positivity, and it is really interesting. I like that you highlight what's happening in kind of those dead retail spaces. It's a great, as I was speaking with a developer, I was at ICSC in Toronto, the franchise show, and speaking to some of the developers there. And fitness facilities are often such a great partnership for them, because generally you take over a larger footprint, but you're attracting people that are, hey, I'm going to go to the gym and then I'm going to grab my groceries after. And it's just a great opportunity for some of these communities where they're kind of trying to design everybody to have a walking footprint in one space. You mentioned Gabriel Hardy moving from FIC leadership into federal politics. And we talked a little bit about the goals of the FIC heading into 2026. But when it comes to in practice, what does that look like? So when you're mapping out your route into next year, what actually happens? I mean, people are paying their membership to be part of FIC. So seeing that money and movement, what does that look like?
I've had several trips to Ottawa, meetings with Gabriel and other members of Parliament, where we're really trying to focus on having that conversation about the value that the fitness sector can advocate and provide, most often the conversation is linked to healthcare, because healthcare is the biggest budget line item, both federally and provincially. And we see that the fitness sector is an untapped resource. So Gabriel has opened the doors to having conversations where, we've had the ability to sit down with ministers and shadow ministers and talk about, who we are, what we have to offer, and also understand from their perspective, what is the barrier that, they're seeing as, a reason, not to necessarily agree with our rationale for, recognizing fitness online 33099 or removal of the HST on fitness related expenses. So we're gathering that information, we're challenging it. We don't necessarily agree with the decisions in terms of why, that continues to not be, something that is recognized by the government. But they provided us with the rationale in terms of why they've made their current decisions, and it's enabled us with the capability to go and dive into the data, not just nationally in Canada, but internationally, to see how have some of these international tax incentives influenced behavior for people to become more fit. And there is data that we're compiling and putting forward a report and recommendation in terms of how could Canada learn from other countries that have done this to be successful and impactful. Because ultimately, the government agrees. They want Canadians to be more fit, just like we do. And there's been lots of changes in the healthcare space in recent years. We're now seeing increasingly more and more recognition and inclusion of GLP-1 receptor agonists for weight loss management. And I don't think you can argue with the evidence that the clinical trials have demonstrated with regards to helping control blood sugar and weight management. But what I always like to highlight is those clinical trials, the majority, if not all of them, included an aspect of supervised exercise. So while the government is funding and recognizing and supporting the injections, and a lot of people don't recognize that Ozempic and Wegovy are injectable medicines, it's not an oral thing, at least at this point, although some of those are in development. The supervised exercise was a critical component of that clinical trial. And I'm not aware of any clinical trial research where the GLP-1 receptor agonist medications achieve those results without supervised exercise. And further to that, we know the importance, and it's included in our Canadian movement guidelines, about resistance strength training. And it's also well documented that people only taking GLP-1 receptor agonists are going to lose muscle mass, which of course is going to have an impact on their function, their stability, their balance, their metabolism. And so, I think that these things can go hand in hand. There's a role for the medications, but there's a critical role for, the fitness programming to accompany it.
It's so true. I was just on with a behavioral scientist and we had the opportunity to touch on this a bit. So much so because that wasn't what the conversation was about. So we booked another interview for 2026 to really dive in around the behavior dynamics. And this is a huge, obvious bridge. And the level of adoption of these types of medications, we know as their uses have expanded. Initially, it was just for managing type 2 diabetes. Once we saw the approvals for weight loss, like we are the answer for being a partnership with these medications. But for a lot of these individuals, they maybe haven't been in a fitness facility in years. Maybe they've never been for the first time, but those behavioral changes are going to have a radical output on their overall well-being, their overall health span. So bringing these conversations to the forefront, especially in the now, is of utmost importance. I know that you have the opportunity to speak with leaders in the space, not just in Canada, but globally. So if operators across the globe were to align with a single priority for 2026 to strengthen fitness as essential infrastructure, what should that priority be?
Perhaps there's a couple core components. And I think, first of all, the financial accessibility, but then secondly, the clinical credibility. So, we've talked about, the tax reform that, Liz Clark and her team have been advocating for with the fly-ins in Washington and the HFA. And unfortunately, they didn't quite get to the finish line, but I think there's great logic to the federal government in the United States to advance the FIT Act. And similarly in Canada, we know that these types of things, they don't just make it more affordable, but they save billions of dollars in healthcare expenditures if people are more active, whether it's in Canada, the United States, Europe, Africa, Asia, wherever it happens to be. We need people to move more and sit less. So I would say the other aspect is, with regards to the credibility perspective in the clinical partnerships, there currently exists a challenge from what I've heard when I engage with medical leaders in Canada, and there's not necessarily the degree of trust that they have yet with the fitness sector. They acknowledge and admit that yes, fitness and exercise are very, very important for their patients, but we're not yet at a level where we have established and created these standards that exist in the fitness sector across Canada. And even in the United States, they haven't established these either. But as I speak with leaders, not only in Canada, but also in the United States, there's alignment, and people are starting to support the idea that I've brought forward that in manufacturing, we have ISO standards, in terms of how things are done. But in the fitness sector, we haven't determined what those standards are yet. I've started to have some conversations with the Medical Fitness Association in the United States. They have some standards, but I think widespread, we could look at establishing the standards so that we could determine what are the personnel requirements, the HR standards, the equipment, facility operations. If you're going to, be in a situation where you will be in a public-private partnership delivering standardized healthcare fitness-related programming for cardiac rehab or diabetes management or cancer and exercise, what are the capabilities of your organization to receive personal health information, store it properly, communicate that back to the medical team? So we haven't done that. And so, that's some of the apprehension that the medical community has. They're also uncertain about the training status of the different personnel that are delivering fitness programming. These are not complex things that we can't overcome. This is not as challenging as putting a human being on the moon, which we did 55 years ago. We can figure this out. We can work with the medical community to figure out what is it that they need to build and have that trust in us that we can provide credible, effective programming, much like I demonstrated when I worked at the Ministry of Health, where we were able to eliminate the wait list and see 10 times as many patients for the same amount of funding. So in a constraint, fiscally constraining healthcare reality that we live in, we can only spend $1 once. So let's figure out how federally and provincially we can spend those dollars most effectively to improve the health of as many Canadians as we possibly can.
Well, I'm sure in hearing that, it sparks something in operators. I can't imagine anybody that has a fitness facility that wouldn't want to be part of that movement. So how can people get involved in the FIC if they are not already? And also, I will put the date in the show notes, but you can also share an opportunity for them to join us and Aaron Phelan, that's part of the FIC as well, in December. So take the floor.
Fitness facility owners and operators, industry partners who supply equipment and other resources to the fitness sector, they can all join, as well as individual practitioners. They can go to our website, ficdn.ca, and click the Become a Member link to join us.
Zach Weston, I so appreciate you taking the time today. You and I will be collaborating in December as well to take part in a webinar that will be featured, and they can find the information at Fitness Industry Council of Canada. I will make sure to have the website and the links all in the show notes below. But I really appreciate your time today, and I look forward to chatting further where we kind of recap the year and talk about where we're heading for 2026.
Love it. Thank you so much for the invitation, Krissy.
You've just listened to the All Things Fitness and Wellness podcast, hosted by Krissy Vann. Be sure to hit like and subscribe. We have new podcast episodes weekly featuring industry insiders and influencers. Together, we're on a mission for everyone to live a life fit and well.